Okay, so welcome to My Health Record and Aged Care training series. This particular topic is on privacy, security and legislation. And the first topic is how to keep your system safe. So we're going to, some of the subtopics are how the government framework supports privacy and security of the My Health Record, why health identifiers are important for security, and how residential aged care are bound by certain obligations that support privacy and security. So before we move into the content, I need to recap some assumed prior knowledge. So what is My Health Record? It is an online summary of an individual's key health information. It is personally controlled. It is part of a national system. It's accessible at all times, and it is protected by law. Now, the access points to enter into the My Health Record will be dependent upon whether you are a consumer or a clinician, and also as a dependent on which discipline you work for. So if you're in aged care, which we are, it will be from your conformant clinical software. So this could be the likes of LeCare, Autumn Care, EK's Clinical Manager, etc. So you will need to talk to your IT department or your software provider to find out when they are becoming conformant. So if you're a clinician, could be a GP or a specialist, they will be accessing from their clinical software, which of course will differ to those that you use within the aged care system. Likewise, in a hospital, whatever software they're using is how their clinicians there will access it. And if you're a consumer or a resident, it will either be through MyGov or the My Health app. Now, if you are a healthcare provider and you do not have any conformance software, you can log in via the National Provider Portal. This is, however, a viewing-only platform. You cannot contribute information. Now, the graphic at the bottom provides an idea as to the types of overviews that are available. There are a lot of documents that sit under these, but we talk about that in a particular, another topic a little bit later on. So these overviews are to assist healthcare providers with easily finding the most relevant information or documents the My Health Record system generates. These are consolidated views. Some of these are the prescription and dispense view, the medicines view, the Medicare overview, the medical conditions view, along with the immunisation consolidated view and pathology diagnostic imaging. Some of the other views we have is the residential care transfer overview. I'm going to be talking about that one a little bit later on, but I just wanted to highlight that one in particular because it's more specific and relevant to the aged care. So the My Health Record system is managed in line with the Australian Government Protective Security Policy Framework. A lot of words there. My Health Record data is stored in Australia and it is protected by high-grade security protocols. And this is to detect and mitigate against any external threats. The system is tested frequently to ensure these mechanisms are robust and working as they are designed. Design features include many safeguards to protect the information that is stored within the system and data management controls, as well as appropriate security measures to minimise the likelihood of unauthorised access to information within a person's record. In addition to these measures, the My Health Record system is protected by legislation, which governs the way the system is accessed, managed and used. The My Health Record system is supported by a legislative framework that sets controls around, around who can access the system and the information that is contained within the system. It is secure through multiple layers of international best practice in IT security. For example, the Australian Digital Health Agency have a cybersecurity team which monitors, maintains, and improves the system 24/7. So the My Health Record legislation, the protection is offered obviously by the legislation that governs the way the data is managed by the Australian Digital Health Agency and healthcare providers that accessing the data that is held within it. This is outlined within the My Health Records Act of 2012 that you can see listed here. As you can see at the bottom, the rest of the framework involves not only the Health Records Act, but the My Health Records Rule of 2016, the My Health Records Regulation of 2012, the Healthcare Identifiers Act of 2010. Now, if you don't know what a health identifier is, I will explain that in a moment and how this impacts security. In addition, most healthcare providers have obligations to protect personal and health information anyway under the Australian Privacy Act 1988. Health identifiers. So within the back end of the system, there's 3 identifiers that are used by the Health Identifier Service. Now, all of these 3 must converge to facilitate access into the system. This triangulation of encrypted data is used for identification and permission purposes to access. Now, the first one is what we call affectionately the HIPPO, the Health Provider Identifier for the organisation. Now, this is issued at the time of registration of your service and will be linked to HPOS. You're probably familiar with that terminology. It's Health Provider Online Services, and you will probably utilise that already. The next one is the Healthcare Professional Identifier, otherwise known as a HIPPI. Now, this is linked via APRA, and for more information, we will have that expanded upon in other sessions. The other piece of data is the IHI, which is the Individual Health Identifier. Now, this stringent registration process that you go through as a residential care home ensures the healthcare provider demonstrates who they are as a provider, as a business, and they have to prove that they're providing direct patient care. Now, when you do go through the registration process, you will note that you have to link your HIPPIs to your HIPPO. That is part of the process that you need to go through. So all your clinicians are measured against the organisation they actually work for. So once you've established a security and access policy for your organisation with the My Health Record system, you're required to comply with a range of ongoing participation obligations, I beg your pardon. There are actually 12 obligations and they're listed quite clearly on the website, and we've got links to all of this information and we can share that with you. At a high level, you are required to ensure information being uploaded to My Health Record system is prepared by individuals that are actually a registered healthcare provider who have got a healthcare provider identifier. That's your HIPPI. It is important to conduct regular checks to ensure that an individual that is using the system on behalf of the organisation have a registration that is not conditional. It can't be suspended, it can't be cancelled, and it can't be lapsed. You have to train the users of the system regarding appropriate collection and use and disclosure of My Health Record information. This includes awareness of organisational and individual legislative obligations specific to the My Health Record system in accordance with the Privacy Act, and any relevant state and territory laws. Some differ, but there is no difference within WA. You have to ensure that the data quality is maintained when information is uploaded to the My Health Record system and that it complies with the relevant legislative obligations. This includes establishing and maintaining a list of individuals authorised to access the My Health Record system on behalf of your organisation and ensuring they are registered healthcare providers. You have to notify the agency as well, the Australian Digital Health Agency as the system operator, and where relevant, the Office of the Australian Information Commissioner, as soon as practicable after becoming aware of any breaches to the system. It has to be obviously related specifically to My Health Record, and there is some links, and we will at the end of the sessions, and we do also have a more expanded session on managing a data breach in a moment. And that talks about the steps for notifying the relevant parties of the breach. So the conversation around privacy and access codes adds another personal level of protection and privacy. Now, this will be discussed in a slightly different context in a moment. And that's going to be under the section called emergency access. And if this terminology is unfamiliar to you, please feel free to put some questions in the chat later on. Hopefully I will expand on them by the time we get to the end. So as clinicians, we must abide by any record or document restrictions, and failure to do so will result in a penalty, which there are fines and potential prison terms for doing the incorrect thing. So we need to make sure that if there is a code that has been put onto the document or onto the whole record, that we need to make sure that we abide by that as a clinician. So patients can access the codes, as I mentioned, at a number of levels. And there's some terminology, there's a lot of acronyms in here, and I apologize for that, but there is a record access code, an RAC, and LDAC, which is a limited document access code, which is at a deeper level. So RAC's whole document is being locked by the consumer, so the clinician needs a code, or the LDAC is like a document within the record, has got some restrictions on it, which just means as a clinician, if you're going in and you see those things come up, a little pop-up message to say, please enter the code, then the patient must give it to you. So personal notification codes can be sent, notifications can be sent to the consumer every time a clinician accesses the record. This is a little ping to an SMS just to say this particular clinician at this particular healthcare provider service has accessed your record. So as a consumer, you can go and set that up as an alert. Another safeguard of patient privacy is that all instances of access into My Health Record are actually monitored and is audited by the Australian Digital Health Agency.